All right, on this patient, we're going to be treating these deep nasolabial folds and marionette lines. Because of the depth and the heaviness of her cheeks, I've decided to use Radiesse. In this syringe, I have mixed 0.4 cc's of 1% lidocaine. And you can also see that I've bent the needle a little just to help me get the right angle for insertion. So now we're going to start, and we're going to go in a deeper plane here. And as I'm injecting, I'm withdrawing the needle, and then I stop injecting right before I pull out of the skin. Because this has numbing in it, I like to treat every area a little bit, and then go back to the areas that have become numb. In a retrograde dissection. Turn your head towards me a little bit. Good. So that's going to get every area starting to numb. Now we're going to come horizontally here to work on these heavy marionette lines. How you doing? Is this very uncomfortable? Do a little X here on the oral collagen. And maybe one vertically here as well. It always helps to smooth out any irregularities. Disperse the product. You're already starting to see an improvement there. Alright, now we've already numbed this side with a little bit of filler. We're going to work a little bit more now on the oral conjure and the marionette lines. Again, this is Radiesse with some 1% lidocaine mixed with it. And I'm going to treat horizontally here. Giving a retrograde injection. I want most of the product to be medial. That's why I'm coming at this angle. And I stop injecting before pulling out of the skin. Maybe a little fanning technique here. These are heavy nasolabial folds and difficult to elevate, but my best chance of doing this is with Radiesse. Try a little depot in here. It's always nice to open your mouth and feel inside. Make sure that it's not lumpy inside. Sometimes the patient will tell you they can feel it with their tongue. In that case, just press it out. Is that hurting you? Okay. Much better. Now we've already placed some Radiesse here. It should be getting numb. I'm going to layer this with a little perlane, just to soften these folds a little bit more, and then we'll move on to her lower lids. Now with Radiesse, we always tell patients it'll feel a little bit firm for the next few days, and then it'll soften. I can go a little more superficial with the perlane. I'm bending the needle just a little bit, And we have radius in deep. We're going to layer this with a little purlane. Also has lidocaine. And just sort of topping off those folds. And we'll see if we can put a little bit more purlane in here, a little more superficial, to bring those oral commissures up some. You can feel a little area here that I've missed. Hopefully that will bring it up. You can push it into where you want it. It's a helpful technique.